Medicare has recently provided coverage for patients receiving testing for the breast cancer index. This is clearly appropriate in my mind. I would certainly support that it extend on to the other private insurers because, frankly, anyone receiving hormonal therapy, whether or not they're Medicare eligible or not, should have the opportunity for this sort of test to be applied to them when they hit the appropriate time frame. Medicare is often the first to adopt new technologies and new treatments, but they're also hopefully a signpost for the third-party coverage to look with a critical eye at the test and appropriately adapt them into their treatment plans as well. Clearly, if one looks at the advantages to them, a breast cancer index score that would indicate a patient should come off of therapy is advantageous not only to the patient in terms of their side effects and risk, but also advantageous to the insurer to avoid having not only to pay for the cost of the drugs over the next 5 years, but also to potentially deal with risks and complications over those 5 years to come. So why they would not follow Medicare's lead is, I would find that confusing.
I think that insurance coverage really goes back to personalized medicine, and now we have coverage for BCI from Medicare. It really seems as though every insurance company out there should follow suit, just as though we want to individually take care of our patients, insurance companies should want the same. There is no medication without potential side effects. And limiting access to a test such as BCI that's out there and available to tell us whether or not a patient will benefit from therapy, to withhold coverage really does not make any sense, and it is not in the patient's best interest.